So what ends up happening is the folks that want to, or the folks that need access to primary care or specialists, oh my gosh, these stupid fruit flies, primary care or specialists have to go out of state, literally out of state, even though there are, let's see, two, three other major health systems in the city. They literally have to go out of state. So here I am driving, and I'm talking about an hour and a half to 2 hours minimum without traffic. Driving out of state to go to the sister location of this hospital in order to receive care. There are a few considerations I want y'all to think about. One, public buses, don't go out there. Okay. Two, when you're talking about a 2 hour minimum commute both ways, one way 2 hours and then 2 hours back, you can't go to work on the same day that you do that. You can't. And then three, check this out. Check this out. I don't think people realize this, but like when you're receiving care out of state and you're receiving care in a community that is not yours, it becomes even harder to be connected with resources that you're eligible for. I remember doing a screening and they were asking all these questions about depression and of course they're asking questions about social determinants of health. And I'm there like in my mind, I'm like, what happens if I actually say yes, that I actually have a need or whatever, blah, blah, blah. And so they were asking about like, oh, do you need resources to learn about access to food or blah, 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 whatever. And I'm just like, yeah, why not? You know what I mean? Like, let me just see what this is, right? They hand me a paper with a list of websites and a list of phone numbers for resources in that community, in that state. That is not my state. So get this. I was not like, I went through the whole thing. I was not eligible for a single resource that was listed on that page. Not a single one.